Hello, my name is Kathleen Marshall. I want to share an interview experience I had with an LPC, a licensed professional counselor. Mrs. Kathy Frody earned her master's degree here at Liberty, and then she obtained her certification as an LPC. For the past 15 years, Mrs. Frody has worked with children and families with a wide range of diagnosis, including ADHD and autism spectrum disorder. Although she's also licensed for marriage and addiction, she doesn't enjoy that as much as she does working with children. She's well respected among her peers and is often asked to speak at women's events in the area. She's an advocate for children, and she's also asked to provide expert testimony in the courtroom and works closely with the guardian ad litem. Mrs. Frody said that this work is very fulfilling. To see a positive outcome when she helps a family or a child in a legal battle, or when there's a messy court custody hearing, she said at the end of the day, she knows that she's making a difference in a life. Ms. Frody is an independent contractor, and as such, she's responsible for communicating with insurance companies, recording billing, and keeping her records. She's also responsible for communicating with the court when she's called for her expert testimony. Mrs. Frody makes her own appointments, but the front desk will schedule her appointments as well. She says this is the only time that she's grateful for technology, when there's an availability to see and share a calendar with the front office. As a counselor, the most fulfilling aspect of her job is the ability to help people overcome their challenges and to achieve their goals. Seeing a patient achieve resolution is greatly rewarding. To witness the positive changes in someone's life, knowing that you played a role in their success, this helping profession, she said it allows you to make meaningful impacts on the lives of others. Although working as a counselor can be fulfilling, it also comes with challenges. As I said earlier, technology is a big challenge. She stated that many times when trying to connect with a patient via telehealth, there are technical difficulties with either the video or the sound, and she ends up simply calling her client on the phone to carry on an appointment. But she said that's difficult as she depends on body language at the time of session to clarify or to understand her client better. So for Mrs. Frody, she prefers in-person appointments over telehealth. Another challenge can be dealing with clients who resist change or struggle with deeply ingrained issues. Resistant clients may be those who are there not by their own choice, but maybe because a judge required such, or maybe it's a desperate parent. She said it can be emotionally draining to listen to the stories of pain and suffering and feel responsible for helping these people find a way forward. As a licensed professional counselor, she's required to obtain 20 continuing education units per year. She said that staying up to date with the latest research and techniques and the best practices, that's paramount in her practice. Some of the ways that counselors can continue their professional growth can include attending conferences or workshops for professional development, helping them stay current with the latest research and the trends in their field. And these events also can provide opportunities for networking with other professionals. Mrs. Frody says that Google helps her to find many career development opportunities and unlimited learning opportunities. When I asked Mrs. Frody, what recommendations would you have for someone like me, a student, pursuing work in counseling? She suggested several things that I should keep in mind. First, we should always remember that building trust and rapport with a client is crucial. There can be no healing if there's no trust, because a client will not be honest with someone if they do not trust them. She said compassion is necessary. but you need to maintain a poker face, as she called it, for a client may read something in a facial expression that was not intended, and that too can alter their ability to trust. She said that it's easy to be Captain Obvious, but she said, remember, the behavior is there for a reason. It's not always what you see at face value. She said it's easy to look at what's right there, but it's putting the pieces of the puzzle together before delving into a diagnosis. And make sure that you understand the diagnosis and the pieces that that diagnosis has within it, so that this way you can really help your clients on their road to recovery. She said faith is there for her, but it's not something that's always up front. She said you can't just spurt out that you're a Christian, but you can live like you're a Christian, because the client may perceive that as a prejudice or a road to judgment. Now, if a client asks for prayer, then by all means. She said, but that's more the exception than the rule. She continued by saying, make sure you practice self-care. As an independent contractor, she has the ability to take off a week every 3 weeks to rejuvenate herself. She's active in her church and has a strong relationship with her family. That's something that keeps her grounded. Eating right, staying healthy, and getting enough sleep, these all play a very important role in self-care. She said she can't be encouraging someone else to get healthy if she herself is not healthy. Maintaining professional boundaries is very important, and avoid becoming overly invested in a client's life. She said this is imperative to avoid compassion fatigue. She emphasized the importance of leaving a client and their problems at work rather than bringing their crisis to her own home. She reminded me that counseling can be challenging but rewarding, and it requires great empathy, patience, and emotional resilience. Finally, she emphasized the importance of having a system in place. She has a file on each one of her clients, which she reviews before each one of her sessions. But in each file, she has a specific plan created for that client, where they're at. She said, this is essential. This is a plan for their recovery. It doesn't always stay the same. Sometimes she has to make changes. But she starts with a plan and adjusts as she goes. She said, recognizing the symptoms and helping the client move forward one step at a time is one step closer to recovery and healing, and a fulfilling role as a mental health professional. This interview, it was really helpful to me. As a senior at Liberty, I'm soon to move on to the next phase of my education, and learning from others is helping me see what incredible opportunities await for me in the discipline of psychology.